Good evening and welcome to Dr. Melissa Medicine Woman. I am so grateful that you have joined me this evening. Tonight, we are going to be talking about pain relief without taking pills. Now, this includes medications, over-the-counter medications, prescription, supplementation. Yes, that is right. I'm going to give you several tools to help with pain relief because pain is a significant health burden in the United States. An estimated 50 million adults experience pain on a daily basis. That's a lot of people in pain. Okay. So first of all, as we start our show, let me give you this disclaimer. So let me pull this up for you. This show and all its content are for educational purposes only, not intended to diagnose, to treat, to cure, or prevent any disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult your physician, your pharmacist, or other qualified healthcare provider with questions about your medical conditions before starting or using any dietary supplements, herbal remedies, exercise, or nutrition plans. So, who am I? Dr. Melissa Balizan. So I have over 26 years of experience in healthcare. I have over 52,000 clinical hours in both Eastern and Western medicine. I help you optimize or minimize the amount of pills that you're taking. This includes both your prescription medications, your over-the-counter medications, and your supplementation. Let's live your healthy life now, and let's live it pain-free, okay? So my physician friends call me the de-prescriber because I actually help them get their patients off of additional medications. Too many times we just pop pills and pile on more and more, where you're taking a supplement because your friend said to take it. It may not be the right choice for you. So I have a vast amount of knowledge to help you optimize your medications. Now let's get to the heart of the matter tonight. And we're going to talk about pain. As I said, over 50 million adults suffer from pain on a daily basis. Now, this can be pain that's low back pain, arthritic pain, neck pain, migraines, headaches. These are the most common things that are noted. And these are things that we deal with, or a lot of us deal with, on a daily basis. Now, pain can be caused acute or chronic. Acute pain is something that happens like from an injury, and we have pain, we fell down, we hurt our leg, we have an acute injury. Chronic pain, that pain that could have been that acute injury, could last longer, where our leg never healed properly. Something happened. That's usually what happens, is that an event happens, some kind of accident or something, or it could be a condition, but what happens is that happens and it's acute, but then it becomes chronic most of the time. If it's not being able to be treated or handled acutely, things become chronic. So tonight we are going to talk about a lot of different ways that you can actually help. I'm getting a glare here. So we can actually help with eliminating your pain without taking the pills. Okay, so what is pain? And so I thought of pain, P-A-I-N, persistent. It can be aggravating. It can be intense. It can be needing. It can cause you so much drama and trauma that it can change your lifestyle. It can change the way that you're acting, you're dressing, that you're doing things. And so I wanted to also let you know that pain can be emotional, it can be physical, it can fluctuate with hormones, it can fluctuate with stress, anxiety, depression, relaxation. All of these things can affect your pain. Okay, so as we're talking about that pain, whatever it happens to be that you're dealing with, let me give you some solutions. So I want to talk about multimodal or therapy approaches. Now, multimodal, the word multimodal came about many years ago. And I can remember I was in the operating room working, and all of a sudden the surgeons are like, we want multimodal therapy. Well, it came about, and I was part of the pain team, and we worked on different avenues of various different modalities of pain control. And a lot of it revolved around different types of pills, because we're in a healthcare environment, different types of pills that acted a little bit differently on the body. They had different receptors that they had affinity to. So we had red pills and blue pills and green pills and yellow pills, let's say. And in your body, you have red and yellow and green and blue little receptors. And so if you remember that game as a kid, where you have the little shapes and they have to fit in the right hole, that's what happens with our bodies. And when we're trying to block that pain receptor, we have pain receptors that are sent out. And then we have these pills that we take to go in and target that pain receptor. Okay. And so there's a red affinity, for example, the triangle matches the triangle, or the square matches the square. So think of it that way. Now, when we worked at the different modalities, and we have we have higher level of pain control, lower level of pain control, some narcotics, some not, and they acted differently on our pain receptors. Well, we're going to talk about different ways that we can address non-pill form or non-pharmacologic and still be multimodal, because we incorporated, as part of the pain team, we incorporated things, some of the things we're going to talk about tonight, that weren't just pills to be taking. We incorporated things like music. We recommended hot and cold. We recommended a lot of different things, and we're going to talk about each of those here tonight. So first of all, I do want to talk specifically. I think there's about, I don't know, maybe 8 or 10 we're going to talk about here, because I want you to realize that our goal for you is to be able to be in less pain, of course, and to be able to have good quality of life and be able to function. Now, some people can function with some pain and others cannot. So my goal for you is to be able to find something that's going to help your pain and put you, so we're not putting you at risk of taking medications. If you're trying to get off of those pain relievers, then let's have a chat so we can get you safely off of those without having any rebound effect, okay? Because if you are taking something like an opiate painkiller and you've been on that for a while, then those in itself, by just taking an opiate medication, that can cause respiratory depression. It can cause you to be sleepy. You have a risk of becoming dependent upon it because of the type of medication that it is. And there is a risk associated with overdose, because you're taking more than what may be necessary for your pain control. So we want to make sure that you stay away from things that might be a safety concern. And so while there's a time and a place for Western medicine, as you know, I say that, there might be for that acute broken femur, your femur is cracked in half. There might be a time for you to actually use some pain medication because you have to have surgery. Going through and doing music therapy will help, but it may not be the only thing that's going to work for you. So let's get into some of the different things. So we have what we consider non-pharmacologic therapy. So these are things that are not related to the pills. So, when we're taking pills, these are non-pharmacologic things. So this is not about taking a pill. This is not what this is about. This is about using things that can help you with your pain relief without taking those pills. So we're going to talk about, and they kind of fall into these big overarching categories. So we're going to talk about things like lifestyle, physical rehabilitation, mind, body, complementary and alternative medicine, as well as some devices, and then even a little bit about possibly some invasive. Okay. Now, invasive would be things like surgery. So, in certain instances, we do need to have surgery in order to fix the problem. You know, if that broken femur, it may have to be professionally surgically set, and in order to have pain relief, because if you're otherwise, you're going to walk around with a broken bone sticking out, and you're not going to be walking because your femur is broken. So, let's talk about lifestyle based treatments. Okay. And you've heard me talk about whole body health. And this is kind of this is one of the components of that. So this could be a piece of that. Now, I like to use the word movement. You may have heard the word exercise. And in the past, we used to think rest. Make sure you rest. Make sure you rest that we don't want to overwork the body. We don't want to overdo things. But what happens is we have learned over time, in certain instances, rest is good for a short period of time. But overall, it is best to move. Okay. Movement is medicine. Now, please check out that episode that my dear friend Jana did the other night on my channel and watch that, because you'll learn so many different things about movement is medicine. So moving your body is actually very good. Now, we want to be able to move it within relation. So you may think, well, I have this pain. I'm going to hurt worse, or I'm going to be sore. Well, that's not necessarily the case. So we can do low impact or no impact exercises. Sometimes we do water therapy to help lessen, you know, if you're doing joints or especially joints, then you can do water therapy. Those are things to lessen the impact on your joints. Now, we want to be able to use that exercise or movement to decrease the pain. Okay, relieve the muscle tension, and that can be done with moving our bodies, even just a little bit. You are sore from pulling weeds one day, so you were out moving, you're pulling weeds, and maybe you wrenched your back just a little bit. You come in, and the next day you don't want to move at all because it hurts so bad. Let me tell you, we'll talk about a couple of different things in that scenario, but moving is going to be better for you because you're going to be able to stretch those muscles, and they're not going to tighten up on you. If you just sit back and you do nothing for the next day or two or whatever, you're going to be in more pain down the road in the long term. So making sure that you're stretching those muscles, and then we'll talk about some other hot and cold therapies that you could do for that particular example. Now, things that can help: nutrition. So specific things that we eat, and we've talked about things that we've eaten in several of the episodes, so please be sure and check those out. Anti-inflammatory diets. Well, what are those? An anti-inflammatory diet is a diet that is foods that don't have the inflammation causing things. So when you're taking, sometimes a pain reliever is an anti-inflammatory. So inflammation, if you are in pain, you are inflamed. So what happens is when you are in pain, your body is inflamed in that area. It's inflamed because it goes to protect that particular area that is hurt. Now, if you are living in inflammation, which a lot of us are, then an anti-inflammatory diet can help lessen the pain. Now, what is an anti-inflammatory diet? An anti-inflammatory diet is a diet high in vegetables, fruits, whole grains, very low animal protein, very much like the Mediterranean diet that I spoke about on one of my episodes. So please go and check that out. Now, minimizing processed foods can help reduce the inflammation. So let's walk it through. So exercise, nutrition, sleep, all three components of whole body health, just wanting to be healthier overall. So sleep, if you're not getting enough sleep, you could be in pain. It could be, you could have inadequate sleep. Your pain could be causing you not to be able to sleep. And then you wake up and then you're in more pain or grouchier because you're not getting your sleep. But when you're not getting enough sleep, that's affecting your overall health. It's affecting your cognition the next day. It affects your cardiovascular health. It affects your cognitive health. It affects your mental health. All of these things start compounding. So sleep is one thing that's very helpful for pain relief. So there is a little bit of rest involved. Getting good quality sleep and resting that your body, because as you sleep, your body is healing. So in the example of you pulled weeds, you hurt your back when you're out pulling weeds, then resting, making sure that you come in, do some stretching, maybe some ice or heat. We'll talk more about that. Stretching your back, not just sitting the next day, but resting at night, getting the proper rest, then that's going to be helpful for you maintaining and having less pain. So getting adequate sleep is very beneficial for less pain. Hot and cold therapy. So let's talk a little bit about that. Now the saying, the saying is the thing I learned in pharmacy school, especially for acute injuries. So this is where you fall down and you've sprained your ankle, okay? Acute therapies, we learned the term RICE, rest, ice, compress, and elevate. And so there's things in there. So when you have acute pain, you come in and you've wrenched your back from pulling weeds, you can come in and you can put ice on your back for 15 to 20 minutes, making sure you put a barrier, so a cloth or a towel. You don't put the ice directly on your skin, never, ever, ever, but in short periods of time. That ice can help reduce the swelling, reduce the inflammation, okay? Now, that can be used throughout. It is best on an acute injury, but it can be used a little bit later on. The other thing, so some people don't tolerate the ice as well. Heat can be used in certain instances, like for the example of you pulling the weeds and your back is hurting. You come in, you can use some heat, same thing. You must have a barrier between the heating pad, or the hot pocket that you've put on there before. You don't put it directly on your skin, and never, ever, ever put heat on an open wound. Never, ever, ever apply a medication like an ointment that helps with the pain relief and then put heat on it. Do not ever do that, because what will happen is you will absorb that medication a lot faster. You could overdose on that medication. So never, ever put heat over medication. Don't put ice over medication either. That's not a great idea. But what happens is that when you're putting that, that temperature extreme, so the hot or the cold, it reduces the swelling, and it allows your body to relax and be able to start healing. So the healing process begins. Now, some things that are used, paraffin wax. Now, we usually see this when you go in to get your manicure or your pedicure done. Paraffin wax is a heat wax that can be used, and it's used when you go in and you have like a wax therapy treatment. What it does is it helps the heat, it penetrates deep into those tissues, and it helps to increase the blood flow and the muscle and joint flexibility. So that's the same thing with the heating pad. But the paraffin, it's in that wax and it's contained, and so it can be used for short periods of time as well. All right, now let's talk about PT and OT. So physical therapy and occupational therapy. So this is where you would go see a physical therapist or an occupational therapist. They would usually do an assessment with you and assess your muscles, assess your joints, figure out how you're moving, figure out how the best way for you to move based upon your injury, give you some exercises to help strengthen your muscles. Okay, that's very important. I had a client who injured his knee, and I sent him to PT because he needed that. And they gave him exercises, and he said, well, I'm already, my muscles are already strong, look. And I asked him, after the PT session, and he's like, well, they just told me to do this. And I said, yes, because even though your muscles look strong, you've been babying them because of your knee hurting. And so you still need to re-strengthen the muscles around that particular knee. So the exercises were to strengthen his quads and strengthen his calf. And that's done because that helps support the knee. Okay, so our body works in conjunction. So PT and OT. Now, the next one is massage. Now, massage is where they do physical manipulation, usually on soft tissue. So they're going in and they're massaging your area of pain, and it can relieve the pain and relieve the tension because it allows you to relax. It can break up adhesives. So if you think of, there's different massage techniques, but between your muscles and your ligaments and then the fascia. So when you get a piece of chicken, let's look at that. So you see that skim on the piece of chicken, the little connective thing is you usually pull it off and get rid of it, but that's the fascia. So that's holding things together. We have fascia as well. And when you release the fascia, so massage can help release the fascia, and it helps to release that tightness in your body of whatever area of pain that you're in. And sometimes, either they are massaging those muscles, they're massaging ligaments, and then they're releasing that fascia and helping your muscles to be able to expand and contract a little bit better. They're not as tight. Okay, so that's a lot of different things that we've talked about so far, right? So a lot of them have to do with that whole body health, exercise, nutrition, sleep, very much in tune with you living your best life now and you living it so that you can function with less pain and without taking pills. Wow, great idea, right? Okay, so let's continue going. So spinal manipulation. Now, this is not quite intrusive, but a little intrusive. So spinal manipulation is a chiropractor or a doctor of osteopathy is doing a manipulation on you. So they're typically, they're assessing a joint or assessing an area. This is really good for neck pain, low back pain, migraine prevention. You go in and they do an adjustment on you, and often there's a crack because you're realigning your bones, you're realigning a rib, you're realigning some cartilage. So that is done by a professional, but it's no pills. Okay. Now, another one that is popular, you see, especially athletes using, and you can do this if you have if you have pain in an area, kinesiology tape, which is a special kind of tape that helps to provide the physical support. And when wrapped in the right group, it helps to support those muscles. So you've got to know how to apply the tape to whatever area. We see this often in joints like elbows, knees. We'll see this tape applied. And it's an elastic type tape. So it's very specific. So you can't just use any old tape. It's very specific. And then it helps to support that joint, and it helps to protect those muscles and make you be able to move with less pain. Okay. Now, there has been some specific exercises. So not just stretches or different basic things that you can do, but yoga and Tai Chi are one of the ones that have been proven to help provide pain relief. Now, because of the way that yoga has you affect your posture, your breathing, and there's some the attention, some meditation with the Tai Chi and some yoga. It very much puts you in a state of calm and being able to strengthen and stretch those muscles that need to be wherever the pain's at. And it can help you relieve pain. So yoga, Tai Chi. If you haven't started and you're look for a beginner yoga, look for something to help with pain relief, but you don't want to go too far advanced if you've never done that before. Now, the next thing, mind body. So our mind is a powerful tool. And we have things that are called cognitive function and pain perception. So the techniques that are used with mind body, they're techniques that we use to empower our patients, our clients, in order to improve their thinking, their cognition, and to help with the way that they react to pain. So when we think of certain things, sometimes we react certain ways. So when we're able to adjust the cognition and approach and allow us to mind body, to equate the mind with that particular pain and find a way to relate it with less stress, reducing our fear of pain, reducing our lack of motivation. These are different things. And I have one that I use. It's MBSR. It's mind body stress reduction. And that one's specific in that it helps with the mindfulness. So it's still the mind body, but it's very mindful. So when you're thinking of things, our minds are powerful things. When you're thinking of things and you're mindful of how you're reacting to things, you're mindful of your breathing, we're looking at positive effects. This has been very helpful with low back pain, headaches, fibromyalgia, even irritable bowel syndrome, IBS, which is very painful. So mindfulness, it's mind body stress reduction. And it's a technique that we can talk more about if you're interested in, that helps to reduce that pain. Okay. And we're not taking pills. Now, we want to make sure that another way to do is sometimes just to relax, to sit and to breathe. Relaxation, sometimes aromatherapy is beneficial to help us to relax. Keep in mind, if you do have an open wound, then you want to make sure don't put those oils on that particular open wound without knowing what, because they can make things worse and that can burn. And then I talked about earlier, music therapy. Listening to music can relax you. Listening to music can reduce your pain. It has that effect on the brain and the body, specific processes. So as you're listening to that music, you're not thinking about that pain. It's able to start healing on its own because our bodies are miraculous things. Remember, our bodies can do a lot of things. Our bodies can even heal themselves. You have to be in the right mind for that to start to happen. The next thing that I want to talk about just briefly is a couple of, so we talked complementary or alternative medicine. Now, a complementary or alternative would be like acupuncture. So somebody's going to go in and they're going to put needles in you, or maybe even do some heat or pressure techniques, some acupressure. So you have acupressure points, and we're able to reduce the pain. Now you want to make sure that you go to a professional who's well trained and who's using safety, good, clean things. So last couple of things that we're going to talk about is the devices. Okay. So devices, I have 3 different kind of devices we're going to talk about. One is a TENS unit. So it's electroanalgesia. So analgesia is the relief, the pain relief. So this is electric stimulation. So a TENS unit, what you do, you apply these little electrodes to that particular area of pain. And you can put them on for usually about 15 to 20 minutes. And you can do it a couple of times a day. But what it does, it sends pulses to that particular area of pain. And it helps to relax those muscles. Sometimes they're contracting and relaxing. So it's like doing an exercise, but the electrodes are kind of doing that for you. Okay. Now the other thing, the other device, the next one is laser therapy. Now laser therapy has been used to help prevent chronic pain from chronic pain sufferers. And it uses, you want to go to a professional, but there is some knowledge that laser therapy using that infrared light has shown to reduce the pain. Now, the last one I want to talk to you about is it kind of falls into a device, but it kind of falls into the mind body. So it's a couple of things. And what it is neurotechnology. So this is human performance technology, which increases the brain's ability to heal the body and to boost performance. And what happens with this one is it is a particular pattern that your skin is able to detect. And I kind of put it in device because it comes on a device. It's a wearable device. So this is wearable neurotechnology. It is something that your skin reads this pattern and it sends the signal to your brain through the nervous systems. So the central nervous system, and it sends a message back, and it's retraining your brain to not be in pain anymore. Cool concept, huh? So this is something that it does. It helps to retrain the brain. And what you can think of it as is it's easy to understand how it works, because the pattern is like a keypad for your garage door opener. It's a very unique set of numbers, a very unique sequence specifically to your garage keypad. And so your peripheral nervous system has specific pathways, okay? And these specific wires that go up to the control unit, to the central nervous system. And so when you punch in this particular code in your garage door, you're sending a signal, okay, to open the garage door. So this particular pattern is sending a signal, and it's saying, hey, let's not be in pain anymore. And it retrains your brain to not be in pain anymore. Very cool concept, huh? So today we have learned about a number of non-pills that you can help with pain. Okay, so if any of these speak to you, please check them out. If you want to know more information about how you can utilize more of these, or you want me to go in more detail, because this was definitely an overview, since there are several things. I wanted to try and cover everything I could tonight about what you can use for alternatives for pain control besides pills. There's lots of different things. And if you want to chat more, then please reach out to me at drmelissabalizan.com. Go in and book an appointment with me, and that way we can chat further and get you set up, get you off those pills, get you pain-free. Let's pick the right choice for you to make sure that you are living your best life now and that you are not in pain, that we can get you out of pain, we can get you off of additional medications and supplements that are not necessary for you. Let's optimize what you are taking. You only have one body. Live your best life now. Take care of it. I hope that these have spoke to you. Please reach out to me. Thank you so much. Have a most amazing day.